Record.
Yep.
Yeah.
Done. So good morning to everybody and welcome to our Ask the Experts segment, which is a special feature today, and that we're focused on health and wellness. And this is actually something that is new for the Chamber in that we have just recently formed a health and wellness committee. And this is one of our first initiatives that we're undertaking as part of that group. And ultimately, one of the things that we wanted to really start talking about as part of that committee were issues that are facing employers. In some respects, it can easily be issues pertaining to health insurance. Maybe it's best practices from a wellness perspective. At other times, it may be topics like today, mental health, as well as just other best practices. And so we've got a great panel that we are excited about here this morning. And so with that, want to do a couple of things before we recognize and introduce our special guest, who certainly is no stranger to any one of us here. But want to recognize and thank our annual partners, who you see reflected on the screen in the back here. Again, these are companies that have supported the Chamber throughout the course of the year, and they go above and beyond in terms of their efforts in helping the Chamber accomplish our goals and mission. But without further ado, want to introduce and recognize again our special guest, and truly someone that's been a friend of the Chamber and friend of me, and that is our County Executive and Dr. Calvin Ball. And County Executive Ball will be making some remarks as it relates particularly to the county's efforts in terms of some of the things that the county is doing as it pertains to mental health, as well as some resources that are available particularly to members of the business community. And so with that, I'm going to turn things over to Dr. Ball.
Well, good morning. Thank you so much, Leonardo, and thank you to the Chamber for your partnership. And I can't tell you how critical and how transformational it is that you are even leading having this important conversation. Because for far too long, there has been too much stigma around mental health, where we've seen some of the most unfortunate incidences taking place because people were just suffering in silence. And I am honored to be here today to talk about this important topic. As we continue on this road to recovery, and we reopen and have some of our employees head back to work, we need to be aware of the lingering mental health challenges, not only brought on by this pandemic, but frankly, exacerbated by this pandemic, revealed by this pandemic, because many of them were here before, and they will be with us in the future. Over the past 18 months, we've experienced increased stress due to unemployment, lack of childcare, isolation, and death of family, friends, neighbors. More than 2 in 5 U.S. residents report struggling with mental or behavioral health issues associated with COVID-19, including anxiety, depression, increased substance misuse, and suicidal thoughts. And that's according to the CDC. If we look more granularly at the effects on the workforce, a recent National Human Resources Survey found that the mental health and well-being of employees aggregated across industries has dropped by 33% during this pandemic. More specifically, there was an increase in the number of employees reporting having less energy, trouble sleeping, and turning to drugs or alcohol just to cope. I'm so proud of the Chamber and all of the employers joining us today, because you have shown and are showing that you care about the well-being of the workforce, and you want to learn more about how we can all be most supportive of our employees for whichever work model you ultimately choose. Now, although Many of your employees may feel like they are alone. They're not. And when it comes to your support, they also have the help of county resources. We launched an important campaign during COVID, and we called it, Let's Talk About Mental Health. And this campaign was designed to point our community toward the many resources we have and encourage them to engage in online webinars and forums about how to get help that they may need. Please direct your employees to www.howardcountymd.gov/gethelp. Again, that's howardcountymd.gov/gethelp for the full listing of all of these resources. Also, our Howard County Health Department serves as an excellent triage to help connect our residents with private and public resources around Howard County and our region, with partners like Grassroots for crisis intervention, Hope Works for domestic violence and abuse, and NAMI for mental health resources. This directory is also included at howardcountymd.gov/gethelp. Employees can also call Grassroots for any type of crisis assistance, and that number at Grassroots is 410-531-6677. Again, Grassroots crisis number 410-531-6677. We also launched a campaign to specifically target and designate for our youth, and we called it It's Okay to Ask. And that campaign is a way to raise awareness of youth suicide and encourage our young people to ask their friends if they're okay, and make it a safe space to ask your young people who you care about, are you okay? And for them to ask for help. We've seen how important messaging is when it comes to eliminating the stigma and helping our young people feel empowered and preventing, no matter where they are, any kind of hopefully suicide, so that they know that they can seek help. Now, as we emerge from this pandemic, is when we need communities, and that includes all of our employers, to help create a welcoming and supportive culture where not being okay is okay. I want to thank you again for your leadership and your partnership. And I just want to give a personal shout out to Carl DiLorenzo, who is my director of policy. He has been my partner in support and working with so many others. He's brilliant and caring. And those are the traits that are needed now more than ever. Thank you so much. And I'll turn it back over to Leonardo.
Thank you, County Executive Ball, and thank you for, again, I think when you talk about caring, certainly I think we all can say that no one cares as much about this county, or at least it's arguable. You can argue that no one cares as much about this county as yourself, and it's demonstrated, I think, by your actions as well as your behavior and just the compassion, I think, that you often share, particularly on issues like this and others. And so for those that are participating here today, if you'll note in the chat, Carl has, DiLorenzo, who again, the county executive just referenced, has placed a link in the chat. And so certainly want to encourage you to definitely bookmark that and take a look at that. For those of you that are watching this live stream, you can visit www.howardcountymd.gov/get-help. Again, that's howardcountymd.gov/get-help, as well as the Grassroots Crisis Services that was referenced. That phone number is 410-531-6677. Again, 410-531-6677. And now, with that, we will get ready to dive into our discussion. And so I am excited to turn things over to my team member here at the Chamber in Morgan Simonette, who was our Director of Membership and External Affairs, who was going to introduce our moderator as well as our esteemed panelists. And we will get this discussion underway. So again, Morgan, feel free to take it from here.
Thank you. Good morning, everybody. Just give me a moment while I spotlight Brenda. There we are. And I'm just going to say a few words about Brenda. We're very happy to have her here today. She is the CEO and principal of Spectrum HR Solutions, a human resources advisory practice specializing in strategic HR management, training, legal compliance, and compensation. Her vision for this company began in 2004. Since then, Spectrum has helped more than 110 companies and organizations nationwide save money, improve employee productivity, and achieve organization growth. Brenda has served the human resources profession for more than 20 years in profit and nonprofit organizations. As the top human resources executive, she has served as an advisor, consultant, and coach to CEOs on organization development and culture, diversity, and inclusion. In 2019, Brenda chaired the HOCO HR's Diversity Inclusion Committee and organized the county's first ever leader symposium on diversity inclusion, bringing top-notch speakers and attracting C-suite attendees. The results of which has inspired several organizations to develop and or create diversity programs for their organizations in an effort to tap into workforce talent. Continuing her work as an advocate for youth and women's issues, she has been reappointed by Governor Hogan to the Maryland Commission for Women. As commissioner, she is working to protect and promote young women's issues, such as education, workforce development, and health. She is a member of the board of directors for the Better Business Bureau of Maryland, and she is a Leadership Maryland graduate, a Leadership Howard County graduate, and Goldman Sachs 10K small business alum. In 2018, for her volunteer contributions, she received the Regional CEO Leadership Award. In 2017, she received the prestigious International Award as Enterprising Women of the Year. And in 2014, Spectrum HR Solutions was noted as one of Baltimore's 100 Smart Run Companies, Innovative Leaders. In 2013, Brenda was selected as one of Maryland's top 100 women, and she was adjunct professor at McDaniel College for the master's program in human resources development. So to say the least, you have quite the track record, and we are so thankful that you are here. If you give me one moment to transition, I'm going to go ahead and spotlight our panelists, and I'm going to let you go ahead and introduce them, Brenda. So thank you so much. Of course. All right.
Thank you, Bert. Let me know when you're ready.
All right. I almost am there. All right. I think we are good to go. It's on you, Brenda. Thank you.
Great. Thank you so much for that wonderful introduction. I really appreciate it. I just do my heart's work, and I love what I do, and it seems to be my calling in life, believe it or not. So not many people get to say that, and I'm so happy that we are addressing in the HR world so many issues around employee relations and mental health. So with that, I'd like to introduce our wonderful speakers, the panel this morning. I appreciate that the opportunity to be the moderator. I'll try to keep us on track. We're going to hear lots of good information and good suggestions. So all of you out there, grab your pads and your technical tools and take good notes, because they've got some wonderful examples of around Ask the Experts and mental health. So having said that, I'm going to move towards introducing, and there's one more thing I want to say. We're going to use the chat for questions. So please feel free to use the chat, put them in there. We're going to take questions after all the speakers are done. And if there's a speaker that you'd like to see or like to ask a specific question of, please include their name. Having said that, our first panelist I'd like to introduce is Stephen Wolf. Stephen is a partner with UHY LLC, a national certified public accounting firm with offices in Columbia. He handles a large number of audit and review engagements and is also involved in providing tax compliance and strategic planning for clients of the firm. He is knowledgeable in a wide range of industries with a concentration in real estate, government contractors, restaurants, and franchisor businesses. Steve has assisted multiple clients in identifying and recognizing available tax credit resulting in significant tax savings. That probably means he was deeply involved in CARES, the CARES Act. Outside of work, Steve is involved in community service, serving as a board member and volunteer for multiple organizations. Our next panelist is Theresa Gayle. Theresa is co-owner and president of Transform Inc., which offers organizational development, consulting, and training services in the areas of leadership, business development, customer relationship management, and employee engagement. Theresa is a recognized keynote and workshop speaker, co-author of the book, Wake Up and Sell, and is a valued resource to organizational leaders who seek her advice and counsel on building thriving, productive, and collaborative workplaces. She holds a master's in human resources management and holds certifications as an Enneagram teacher, hope I said that right, and a certified business manager. Our next speaker is Rachel George. Rachel is the Human Resources Administrator at Home Instead in Arnold and Ellicott City, serving the Anne Arundel, Howard County, Southwest Baltimore County, and Baltimore City, Bowie, and Laurel areas. Rachel has been a part of Home Instead for 4.5 years, beginning her career as an office assistant, moving into recruitment and engagement, and in turn led her to the Human Resources Department. Rachel is continually and collaboratively working with her team to change the face of aging. Outside of work, Rachel enjoys spending time with her family and 3 rambunctious fur babies, Kira, Mia, and Marley. And with that, I am going to start us off. Okay. The questions that you have in front of you on the flyer are exactly the questions that we're going to ask you to follow along with us, because that's what you came to hear. You want to hear the results. You want to hear what they have to say about how do we begin to get our arms around the critical area of mental health and wellness in our organizations. And believe me, as human resources professionals, we've been seeing this for years. So we never want to see, obviously, an incredible pandemic bring out these issues, but thank goodness that they're out and we are ready to help, and we've been ready to help. So having said that, I am going to start off with the first question. And this question goes to Theresa and Rachel, if you want to answer, take turns answering. But the first question is, how do you onboard employees who were hired during the pandemic in a virtual setting and are now transitioning into the office? Rachel, do you want to go first?
Yeah, absolutely. Can go first. Good morning, everyone. So the main difference for us onboarding employees who were hired in a virtual setting rather than in person is strictly just that, with more the virtual side rather than in person. While most of our employees are onboarded in person here, obviously the pandemic allowed us to do it virtually via Microsoft Teams. So while our onboarding, not just our orientation piece was in person or virtually, our interview process as well as the whole hiring process was done virtually via Microsoft Teams as well. So our situation's a little different because our caregivers are out in the field. So transitioning them back into the office was not an option, but transitioning them out into the field was definitely one of those difficult tasks. Just losing that connection, that personalization, and that one-on-one training in person.
Just a quick question, and what were some of the ideas or practices or activities or actions did you take to address those? To address the distance?
That's a great question. So we have what we call our quality assurance phone calls with our caregivers. So where it's not just strictly the client side, it's also on the caregiver side. So we're constantly checking in with our care staff after their first assignment, at that 2-week mark, and then 30, 60, and 90 days consecutively every quarter following. So we're not losing that personalized touch and able to hear their concerns and not even just concerns, but all the good things that are happening as well, and being able to provide them those resources.
Great, thank you.
Thank you, Brenda.
Theresa.
So, in onboarding, the biggest question is a new hire, how can I be successful here? And so that became a challenge when they're not in the office or being able to be around people to watch what are the norms, right? The culture, right? Is this culture? And so one of the things that we did with our clients is we actually brought all of the employees together in focus groups and asked them the question, what are the key values of this organization? And then we asked them to tell us, how do you demonstrate that to the client? How does the organization do that? How do we demonstrate that as employees? And then how do I demonstrate that in my position? So that was a big project where every employee got involved and all the new employees were included in that group, in those focus groups. And what ended up happening is we now have a document and we have a way of bringing every new hire now into that process to be able to, understand what is the transform way, what is the, and those pieces provided a connection. The people that were newly hired were like, oh my God, I never even knew that. And I've been here a year, right? So creating some, that was the fun of last year, if I can say fun, because it got everybody engaged in a conversation about who are we as an organization, and then how do we communicate that to all the new people coming on board. So we have a video now. We have a video now that every new employee is able to see. And it has 2 parts. One is, what is this culture? But then we have employees who, managers and employees who were recorded saying, what does it take to be successful here? And it's a great vignette of that.
That is a wonderful idea. Thank you for that. We're hoping to get more information from you on that in the chat. Next question, and I am going to direct this to Steve and then back to Theresa. What team building exercises should you use to display work styles and encourage collaboration after being remote for so long? Steve, do you want to jump in there?
Absolutely, Brenda, and thank you for the introduction and thank you for hosting this panel. It's a great topic. I was really excited when I heard about it, and was an honor to be participating and giving some of what I've seen in our office and in other client offices. But I think number one with the team building is, as we bring people back, they're already experiencing a lot of burnout over meetings, and they're the ability to focus on the work. Meetings have become somewhat of a distraction in their minds, and they've been very important throughout the pandemic, but there's clearly a burnout factor. So I think number one, as we bring people back, I would kind of look to start doing smaller activities in terms of the time requirement until we, as we bring people back. And I think that they should be fun. Kind of goes without saying, but if people are experiencing this burnout, and don't want another meeting, you got to make sure that you promote it and with excitement, and that it is something that's fun and doesn't take too much of their time, but is effective. I think that they should certainly be activities that highlight problem solving abilities, capabilities, and how people attack problems, because I think that'll be important as we do get back to the office and are collaborating more. And then the other thing I would add is probably just making sure that they're in small groups where people feel more comfortable than in a larger group, or breakout sessions where they can have some comfort and be active participants in the exercises. So this is just some of the things that I think are important. I'm reading more and more every day about what people are doing to bring people back in the office, and these are some of the things I'm hearing.
So, Steve, what examples can you give us of what employers are doing to address what you suggested, which is getting them involved in smaller groups and getting them to feel more comfortable, speaking about what's going on?
Yeah, well, and it may be a big time commitment or a small time commitment, depending how well you achieve this. But I'm actually staring right out my window at the breakout games, right, which is right in our parking lot. I've done that in the past, and that's a really good problem solving experience where people do work together, and hopefully can get out in 15 minutes versus having to be, having to be let out before you solve the riddle. Some of those are kind of tough. And I think just other fun things we've employed different organizations to come in and help us with, games, whether we did a Jeopardy game, and, certainly a collaboration, but really fun at the same time. I think as we go longer into it, I think there'll be, as we start to come back and are more comfortable, and then we can look to do some more, some bigger events. I know that in the past we've used Terrapin Adventures down in Savage Mill, which is a great experience, and certainly focuses obviously on team building. So those are some of the things that I think we're doing and planning to do, and other companies certainly are doing them as well.
All right, wonderful. Thank you for that. Theresa.
So I was just going to say, the coming back in is helping people connect, right? And connecting about what their experience has been, and, what it is they're moving towards. And so we use a tool called the Enneagram, which is a personality-based system, but it's understanding, why people do what they do, and the lens that they have. And so we've done a lot of exercises with our clients that use this system, and even all the new employees with my companies that I work with, we introduce this tool to them, and we actually then, get them to understand sort of, how do I show up at work? What is it that it's important to me? What is it that I value, and what are the strengths I bring? And so how we use that, and how we've been using that as people are coming back in, is to get the teams back together again, to connect back again, and to say, this has been my journey, and this is what I'm really hoping moving forward, how we can support each other, how we can work together, how we can communicate. Because one of the things that's been broken is sort of the operating agreements of how we work together. So finding ways to be able to get people talking to each other about how we're going to work, how we're going to communicate. And so we've done it in a lot of different sort of fun ways. We'll bring them together around a meal, or we'll, be out, Steve said, the parking lots, or, just getting people out, getting them active, sort of focusing on a particular topic, like, let's talk about change. Let's talk about how you've changed. And so the things we've been doing are really sort of on that more personal level, to get people to just connect back at the heart level. Because there's a lot of, things you can be doing, and a lot of things you can be talking about, but it's that heart connection that is something that we're trying to help our clients do.
Totally agree. And just a quick question that the audience may want to know is, can you give us any success stories of using that model?
Absolutely. I mean, just the teams of being able to come together and to, there's been so much email communication, and there's been so much of the looking at each other. And so, just talking about how are we going to communicate? So just, a team that's spread out all over, that was spread out all over the country, and they're going to continue to be spread out all over the country, but bringing them together and saying, really saying to each other, when you do this, it really annoys me. Can we all agree that we're not going to send emails about X? So getting some really, we're about the real deal. It's like, let's put the issues on the table and let's figure it out. So it's, really allowing each person. The thing I love about the Enneagram is that it appreciates diversity. It actually welcomes diversity, so that if I see something a different way, that's great. That adds to our view of something. So I would say the success is in the ability to give people the voice to say what they need to say, and to have the team come together around how do we support, or how do we all work together to value each person on this team.
Thank you for that. All right. Moving to the next question. What trends are businesses implementing to help with employee mental health wellness? COVID, obviously, PTSD. And I'm going to ask Rachel and Steve to take this one.
Wonderful. Thank you, Brenda. So I can go ahead and get us started, Steve, if you would like.
Absolutely.
So our home office actually has implemented what is called the Home Instead support line. Our support line offers, or it was created to help our caregivers with any challenges they may face, not just COVID related, but any other issues they may be experiencing. Our support line offers unlimited phone and any e-counseling services that they may need, referral to local resources within the area, and 24/7 access to mental health professionals without the use of hold, transfer, or triage services. The beneficial part of our support line is that it is private, confidential, as well as always available at all times for our care staff.
And do you see that effective?
I do.
How effective is that? Okay. So
I can't necessarily, sorry, Brenda, go ahead.
No, I was just going to say, is that increasing participation amongst employees and with each other?
Absolutely. I definitely think it's increasing where they may not feel always comfortable coming to myself or other team members, where they're more of an introvert, I guess you could say, and they feel more comfortable speaking to somebody that has no ties to us, and get that one-on-one connection where it's not, could be a bias on a side where it's their employer. So I would say it is pretty effective where they have that opportunity when we're not always available. They have that option.
Okay, wonderful. Thank you. Steve, same question.
Yeah, this is what a great question this is. And I think, number one, I'm seeing more awareness, just increasing the awareness of mental health issues. I really appreciate Dr. Ball's remarks at the beginning of this. I think showing more empathy is extremely important, and probably most important is reducing stigmas. We've got, we're lucky enough to be led by an amazing group up at our corporate headquarters. And Steve McCarty just recently was interviewed and sent out some information to us talking about sharing our experiences with employees. And I just think, that's probably the most critical thing, because, I think the stat was 2 in 5 people are reporting issues. Well, to me, I bet you there's 4 out of 5 that are having issues, and it's just something people aren't comfortable with. And with that in mind, I'll share that, I've seen a counselor for a number of years. because life is difficult, whether it's business or personal. I had, for 2 years, I had, my youngest daughter is now 20, but for 2 years, I had 3 teenage daughters. And I think I kept my therapist in business that year personally. So,
Understandable.
yeah, exactly. And, it's not just about dealing with my own feelings. It's about helping other people, and how do I help other people in our organization, in my life. I mean, that's important to me. And I think the more comfortable people we become with that, I think people are much more comfortable than they were, say, 10, 20 years ago. I remember running into somebody in my therapist's office early on, and it was a little awkward, and then ran into somebody else much later, and it was, hey, how you doing? Oh, you're here, great, good. So I think it's important. I think also providing a safe and secure environment and coming back to the office, because certainly everybody had a different experience through this. I mean, a lot of people had the same experience, but there's still people that are there's a lot of fear, and there's a lot of anxiety, and so what we've done, and I know that many companies have done this, is done everything we could to provide an environment that is as safe as possible as we bring people back to the office. It's a lot safer now, of course, with vaccines available and the statistics on the number of people who are getting vaccinated, but there's still people who can't, or who have relatives who can't, and they're worried about them. So, that's really important to us, and being a good citizen. Our policies have been relaxed, and we're changing them. But, I always say, look, just if somebody's going to be more comfortable if I have a mask on, it doesn't matter what I think and how I feel. It matters how they feel. And so, we try to make sure that everybody in our office is aware of that and thinks about that as we do return. I think communication certainly is big, and getting feedback. We just introduced a tool called Office Vibe, I believe it is. We're rolling that out now, where we can gauge the pulse of the office in terms of whether it's just people providing direct feedback anonymously, or short surveys that we're doing. We're developing a remote work policy right now, so we're trying to get input on that. So, I mean, I think those are the things that I'm seeing, and those are certainly some of the things we're doing.
Thank you. Okay, so I'm gonna keep that discussion going, because that's critical. Thank you for sharing and letting us know that it's okay. As HR practitioners, we've been saying this for years. Let's use the EAP programs. Let's talk about the mental health benefits within the policy. Let's bring speakers into the office. Let's allow you to reach out to these individuals and medical professionals privately, as well as your family members. And so what are some, and anyone could take this one. So what are some suggestions for organizations that have people that don't want to return to the office? They like working remote and would rather do so. And in fact, that is actually what is happening. I think all of us just recently read an article written by McKinsey, a global study, that more than 60% of the workforce don't want to come back globally. and it's probably even in this particular area, it's particularly onerous, because sometimes we've got a lot of essential workers in the DMV. And so how do we begin to help them with either transitioning back or working some portion of remote? Just a quick fact, I know that in the last 12 months, we have helped organizations transition out employees in the last 12 months more than we have in the last 5 years. People leaving, exiting, I'm done, or not showing up for interviews, ghosting us. And all of those are symptoms. So the question is, what suggestions do you have for those of us online here that don't want to come back. Employees do not want to come back. Ideas. Anyone could take this one. Stephen, you were the last to talk, but Theresa, I think I gave the last question to both of you.
I mean, I'd be happy to give my thoughts on it. I think number one, figuring out why are people feeling like this, right? And I don't know, it's interesting because I don't know what I mean, certainly now everyone says this is the new normal. But we've been, business and industry and community has experienced, peaks and valleys in different areas. And I'm not sure that 5-10 years from now, it's going to be the same. It may be. But I think understanding what the challenges are, why people don't want to come back, is it health related? What are their concerns? And certainly we have a lot of technology. We can do a lot remotely, but what we don't get is that sense of a community or a family when we're all dispersed. It's very hard. So, I think getting people back, it's going to be hybrid, certainly in the immediate future and probably long term. I think that there's certain benefits that will affect people's mental health, whether it's commuting time, not having to commute every day. But I think, again, I think one of the most important things is finding out what is driving these decisions. Is it just because people don't want to get up, they want to work in their pajamas? Is that what's important to them? Or is it the commute? Or, is it childcare? What are the issues? And then we can figure out how to respond to it and how to provide.
I think it's all of the above and some that we haven't yet identified.
Yep. Mm-hmm. I agree.
Theresa, can we hear from you?
Yeah, I'll just add on because I think, Steve, you really hit on something that we change when we know what we want to move away from and what we want to move towards. Mm-hmm. Right. And that's where we're in transition right now, because it's been really comfortable to be at home, but then it's not been comfortable for some people that have had the parenting and all of that. So it's understanding sort of what are people moving away from, but as an organization, we have to create the vision of what they're moving towards. And so we have to, talk about the importance of the collaboration and identify where collaboration as an organization is essential. So I have a lot of companies right now that are saying, when we are working on these specific issues, they're in-house collaboration moments, and you need to be in-house. And so there's focus not necessarily on you have to be in the office, but it's focused on those activities that are going to be able to create the most results for the client, if that's who we're focused on, or the employee experience. And those are really the two things that, sort of what's the client experience, because they're the ones that pay our bills, and what's that employee experience that keeps people coming back. So I just sort of add that piece to it. It's that if we can look through that lens of, what do we want our employees to move towards? What are they moving away from? What do they move towards? And what are those moments, those key moments where we connect and where we collaborate that gives us that sense of belonging again, because it's been so disjointed.
Yeah, that's a great point, Theresa.
Thank you. All right. What challenges, and I'm going to toss this back to Rachel and Steve. What challenges are businesses facing mandating COVID vaccinations, and how is this affecting going back into the office? And if you could cite some examples, that would be great.
Okay. Steve, if you want to take it over, I can start.
Go ahead. Why don't you start?
All right, perfect. So at this time, we're not currently, or we cannot mandate vaccinations or not being vaccinated, but we are strongly recommending it to our care staff. We here in the office have been vaccinated, but it is definitely a comfort level to our care staff. So we solely leave the decision up to their discretion, of course, but we have implemented mandatory weekly COVID testing as an alternative. So whereas not all of our care staff is comfortable doing the vaccination series, then that is totally their decision, which in turn, then we can help them schedule their weekly COVID test, or they can do it on their own. With those of our employees that are getting weekly COVID tested, we do compensate them at 1 hour of their time, because they're either doing that on their personal time, or they're doing it based around whatever they have going on in their personal lives, of course, around their work schedules, their kids' schedules, all that good stuff, of course. Where those that have completed the COVID vaccination series, we have supplemented them as well. Once they have sent in their COVID vaccination card, have completed the full series, they do get reimbursed at a certain amount for getting that done. And we do believe that, the vaccinations are important for, not just our caregivers, but our clients. But like I said, not everybody is comfortable with that piece. But that's what, again, we are up against right now, coming back to some sense of normalcy as well, is our clients are your caregivers vaccinated and unvaccinated? Our caregivers that are not vaccinated, they're saying, well, if you make it mandatory, I'm going to quit. So we're up against that piece right now. We're still trying to work that piece out. But I definitely think, giving them that option between either the vaccination or the weekly COVID testing has been a great thing for them to do, to help maintain the safety for themselves, the clients, and the clients' families as well.
So Rachel, that makes perfectly good sense. However, you're in the caregiving world and caregiving industry, and I would expect or suspect that with the elder population, they're more vulnerable than the other. It's already been proven they're obviously more vulnerable, and under those circumstances, mandating vaccine or keeping them away from patients if they're unvaccinated is not, it's stretching a little bit, but not necessarily illegal because you can show cause, right?
Right.
So is that something that you guys are considering because of the risk to your clients?
So with that too, we do, for our caregivers that are vaccinated or unvaccinated, is mandatory that they continue to wear a mask at all times under any circumstances, regardless if the client says, hey, it's okay, take it off for 5 minutes, no matter what. It's just to maintain that safety net for everybody involved.
Okay, thank you.
You're welcome.
Yeah,
all right.
Rachel, I wanted to make sure I understood you correctly. You said that you guys are not allowed to require people to have the vaccinations?
At this time, we can't mandate it. Now we're following CDC guidelines where my supervisor, who is involved in COVID as well, she's looking into the logistics. She's on the marketing side of things. So looking at the legal aspect on if we're able to mandate it now at this time or not. Are you allowed to ask for employees' vaccination cards or are you not? Where's that fine line? Because you don't want to over ask and that, step that over that boundary, of course.
Yeah. So, and I guess maybe I'm not the right person for this in terms of an expert on this panel question, because, well, I will say that, what are the challenges? Number one is understanding what the legality is. And I just assumed that prior to the vaccinations rolling out, I just assumed that was something that we couldn't mandate people do. And then to come to find out, I think we are allowed to do it. We're not. We made the decision
in certain
not to
circumstances,
do it.
right?
Right. So certainly,
yeah,
the challenge being understanding what the legality is, and if you don't have your own HR department who's able to look into and understand those laws and guidelines and everything, people should be reaching out to the consulting world and the HR consulting world to find out what they can and can't do, number one. And then you got to look at what's right, or what you feel comfortable with as an organization, because that may or may not align with what the legality is. And the other thing is just understanding how it's going to impact your workforce. Are people going to decide to leave if they're not getting vaccinated? And if they're required to be vaccinated? I think the one good thing that I'm really happy to say that throughout the entire this entire experience from day one, our HR department did an excellent job, and we worked with a team. We had a special task force team in our office to deal with the health and safety issues. And while we certainly were no stranger to people, contracting COVID, we didn't have a single instance that we identified of one coworker giving it to another coworker, which was awesome, and just a testament to our folks. But
this is where a wonderful employment law attorney can really add value here.
Yep.
As well as picking up the phone and calling someone at CDC or Department of Labor. I think we're stretching all kinds of boundaries because we're in territory we've never been in before. So quick question, are you, Rachel, are you also enforcing that patients wear masks if they're not vaccinated?
If it's in their home, then it is not a requirement for them. They're in their personal home.
Yes,
we just ask full
care.
Transparency, of course, from all sides. Caregivers,
Gotcha.
clients, families. If you're traveling, if you're having even the smallest of symptoms, our clients are immunocompromised, our clients that can't afford to get sick. But we leave ultimately, Brenda, the decision up to the clients and their families. If they choose they want to wear a mask in their home, they can, but they do not have to.
Thank you. I know it's not an easy thing in your industry at all. So
it is not.
Kudos for working through it.
I'll tell you, scheduling weekly COVID test every week was a battle, but definitely being able to have those resources from the counties, it's been much easier, so. But yes, it's been tough.
I feel you definitely. We were all over the place helping employers with policies on COVID and what to do, what not to do. And
what can you say? What can't you say? And
that's exactly right. And we have to consider and then keep up with the ever-changing Families First Coronavirus Act and what that meant to EFML. It was crazy. Still is.
It is.
Okay. One last question. And then we want our audience to be sure and dump questions into the chat so that we can get questions or cite examples or more information that you may need. So use the chat. What are barriers to employees returning to the workforce, and how would you overcome them? And that's to my entire panel. Who have we not?
I can jump in there. So I guess one of the big things that we're experiencing is that boundary between unvaccinated versus vaccinated right now. Unvaccinated, we have employees that have avoided returning to work right now because they're over that age limit of 65. And I didn't get to mention it earlier, but we have caregivers that are of that age, or they're just not comfortable returning right now for one reason or another. We do give them that option to make that decision. If they're uncomfortable, all you have to do is say, hey, Rachel, I'm uncomfortable. And what we do is we place them on what we call standby status. That standby status holds their employment with us because nobody's fault that COVID happened, right? So what I do then is I follow up, weekly or every 2 weeks just to see, hey, how are you doing? Do you need any resources? We are still here for you. So they don't fall under the wayside. So we're up against the unvaccinated versus vaccinated side quite a bit on both sides. Another thing that we're facing is contracting COVID once returning back to work. Not just on the caregiver side, but the client side and the family side. They all have that barrier up. They're all ready to protect themselves and everybody around them, of course. So, asking the questions, is your caregiver vaccinated? All those questions that come along with it. But we just are reassuring our caregivers as well as our clients' families and clients that of our protocol, our policies to help keep them safe while providing care. Again, as I mentioned before, leaving the discretion up to that individual employee in regards to everything in regards to those barriers. And then the big one is lack of that social interaction during the COVID months. forgetting how to return to work, or why do I have to work right now? I'm making more on unemployment, or, up against all these things, and we're stuck. So we're just finding those ways to be able to reassure them that, it is okay. We're here. We can help you get through this process. We've lived through it. And I think those are the main three things that we're battling right now is, contracting COVID, vaccinated or unvaccinated, and that social interaction.
Of course, especially with the new strain
Absolutely.
that we keep hearing about, and people are still getting catching the virus.
Mm-hmm.
So even though the numbers have dropped significantly, they haven't gone away, and we may not see that for a long time. Okay, can we have Steve? Did you want to jump in, or Theresa?
Theresa looked like she was ready, so I'll let her go ahead.
Yeah, I was just going to add, one of the biggest tensions that I think exists, and again, many of the clients that I work with have employees that do not live in the local area. They found over the COVID time that they could hire people outside that had the skill set that they were looking for, and so they hired people that would not be in the office full time. And so there's a great deal of tension between those local employees that are now expected to be coming back to the office, and those that are a distant and will probably not be coming back into the office. And so that is a real tension, and it's going to exist. It's going to stay, because they've made this decision to hire these people who are no longer 100% local. So some of the things that it calls upon the need for a hybrid. So giving the local people the ability to have a choice in terms of some days in the office, some days out, because
Sure.
I think everybody found that they were more productive at home. And I think the managers realized that their employees could be productive at home. There was sort of a mindset, if I don't see you, then I don't know that you're working hard. And I think that all got sort of thrown out with the fact that people really were productive and that they could be. So I think that there's a great article that I'll actually put in the chat box that was Harvard Business Review, where a writer said, why not to give your employees the choice of the days they work from home? And it's a great article because it sort of talks about that, there's choices we want to give our employees, and then there's things that we need to look at our business and we need to say, this is an absolute. We can't move right in too far this way. And so I think it's really important to go back to our values and to say, who are we as an organization and what's important to us as an organization? And make our decisions based on how we set up this moving forward with our employees, and the message we communicate about why we're making the decisions we're making is just so important. It's all about communication, and it's all about, what Steve talked about, what Rachel talked about, this, how do we engage them back into this culture and get them to want to be a part now of the organization. The ongoing challenge is going to be the distance employees and how to keep them engaged. And they're always going to feel as if they're not totally in. And so, one example that one company has is that every distant employee, when they were hired, had to agree that they would be on site at the office a certain period of time. So like once a quarter, they had to be on site for a week. And as a way to be able to, create the connections face to face.
And I do know that can sometimes work very well. I think bringing employees into part of decision making is absolutely critical. I know one of the things we did, because people are living in the moment, and it's very difficult to plan beyond that. But always keeping our hands on the pulse. So we came up with kind of an HR crisis response 4-point categories to deal with as it was happening, because there are employees who are not coming back, employees who are not as productive, and it actually causes more stress on the employees who then have to pick up that work until the position is filled, and if it's filled on a timely basis. So we looked at stress management. We did 4 categories of doing of separating and moving into how do we connect all of these pieces. And the first one was stress management and mental health, because that's what employees told us. We do a lot of surveys, or at least pulse checks. How do we keep the business in operation and sustainable? There's employee re-engagement and readjustment for those who are more, who really do need that human contact, and need to find a way to get back into the spaces and the relationships they were in before pre-COVID. And then the last thing we look at is the safety standards and compliance. And those are all treated equally. And we just sort of look at then what's the 10-point plan. We look at is their atmosphere if they're working from home? Does it allow them to be productive? So we get a little granular, which really, really helps. We know some folks are worried about one of their spouses lost their job. They're worried about whether or not they can make the mortgage payment. Some, obviously, we've all been affected because we all know or are close to someone who had this disease and this virus, who caught the virus. Maybe they survived, or maybe it's left them somewhat disabled. So we're looking at the health and wellness environment in which people are living, because that determines how productive they are. And then we are opening doors totally to open communication. Tell us all the ways this is affecting you. And you can tell us in a number of ways. You can tell us confidentially. You can use the hotline. You can call us up. You can walk into office, and whatever you need to do to tell us that maybe you're at the end of your rope. And let's figure out together, how do we get through this? And then finally, we've been training managers on how to respect their employees. Not all managers understand how to respect and manage human behavior. In fact, many of them don't, but they're very, very good at the work that they do, but not necessarily how to manage a team in a way during a crisis. Or even sometimes they haven't really known how to do that effectively, which is where almost 80% of attrition comes from people leaving because of their managers, the supervisors. So we make sure they're trained, and we make sure that we're always in touch, no matter what, with employees. We try to ask what kinds of work-life balances can they suggest for their own coworkers. And then we go back, Theresa, as you had mentioned, to what's the overarching goal of this organization. Let's restate the mission and the vision and the goals. Folks want a direction. They still want to be able to contribute. They still want to be appreciated. They still want autonomy. These are all the things they wanted before, and now it's exponential. So having said that, Steve, I'm going to let you have the last pitch at this, and then we are going to move into our questions.
Yeah, I think it was pretty well said by you, Brenda, and Theresa, and Rachel. But I think, the overall thing is one of the biggest barriers I see is fear. People still aren't comfortable. And there's been news, obviously, I saw in the chat box that somebody mentioning the new variants, and that's gonna stir up additional fears. I think it's gonna erode some of the comfort that we've managed to get back, and I think that is the biggest challenge. So companies, as it's been said, need to just make sure that they're doing everything to keep people safe. I think that I used it, I listened to certainly a lot of information online and podcasts, and I took it as an opportunity 18 months ago to start getting more healthy myself. Now, there are definitely some correlations between, health, and not just age issues, but, certain things. And there's a lot of suggestions, whether it's totally worked or not, I don't know. It was in my house. I had a family member who got it in close quarters, and I didn't get it, which I'm lucky. That doesn't mean it was because of that reason, but I guess what I'm saying is that it can't be a bad thing that I try to get healthier, right? So I think that's another thing that people should be looking at, is promoting more health and wellness overall, not just mental, but physical.
Okay, great. Thank you. At this time, let's go ahead and jump in so we can stay on our time schedule. I'm going to jump right into the first question. The first question from Regina is the weekly COVID testing mandatory?
Yes, our weekly COVID testing is mandatory.
Okay. Oh, and anyone can jump in and answer the questions. Okay. And from, let's see, are you also enforcing patients to wear masks if they are not vaccinated? I think I may have asked that one.
Yes. So right now we are not enforcing our clients to wear their mask if they are in their own home.
Okay. With the Delta variant starting to increase, what should employers consider to be ready for a change in what they require from their employees? Good question.
That's a really great question.
Plan A, Plan B, and Plan C.
There you have it, Theresa.
It's like, I just think we have to we have to have the options ready to pull, because we just don't know.
Because in a moment's notice, things could change. So where Plan A works, on a Monday, by Wednesday, Plan C may be working. You just have to bounce back and forth. I agree, Theresa. Good answer, or good response.
And I think capturing what has worked so far for organizations and establishing a track record of going back and maybe modifying, what works and what doesn't work. But at least we have a foundation, foundational information. Anybody else want to jump in there?
Yeah, I think just evaluating certainly what worked and what didn't through, when we did go fully remote, it worked really well for us. I think I feel kind of guilty, I guess, in that, as an accounting firm or a service business largely that uses computers for most of what we do. And so just going to a different location, we're still able to communicate Teams, whether it's Teams or Outlook or whatever channel. Unfortunately, it's a lot harder for businesses that don't have that ability. I mean, I have restaurant clients. I feel for them terribly, just because what they've been through. And certainly there's been a lot of people who have gotten a lot of help, and that's great. But it's going to be hard for them if if we have a big resurgence, and who knows what direction we're going to go in as a state, as a nation.
Well, hopefully we can put some preventative measures in place now that, we've got a great body of knowledge. Next question. Let's see. After being an employee who has been onboarded virtually, once moving back into the office, do you suggest having special sessions for all new hires? For example, hired during the pandemic, to get them acquainted with office and coworkers?
Yeah, I think that's a great idea. Absolutely, yeah.
Absolutely, and finding ways to bring them together for a particular issue. So sort of pairing a new hire with maybe other team members on a particular topic that, all right, we need somebody to work on how, what's the next fun event. So then you bring a new hire in and you get them into a team that they might not originally have been a part of. we actually did that in a company where every single employee was put on an innovation team. And every time a new hire came in, they would join that innovation team, and they were working on a particular goal for the organization in 2021. And so they began, they just get integrated right away into a team that they probably wouldn't know, but then they get assigned a task. So any way you can engage them is really, the best way to, not just their immediate team, but the rest of the organization is helpful.
And we also
Theresa, you
find
hit on
that
something. I was going to say just real quick, Theresa, you hit on something that I think is really important, which is getting people engaged isn't just about telling them what's coming up. It's about bringing them to the table. And I use this analogy a lot, but over the years, my kids went to a lot of bar mitzvahs, and I saw the dance floor at the bar mitzvah when they first started going versus, when they kind of went through that cycle. And the big addition was these professional teams of people who come out and literally drag everybody out on the dance floor, right? To get everybody involved. And I think you have to use the same technique in a lot of cases because, people, because of their comfort level, it takes a lot more than just sending out, literature and here are upcoming events. You really got to kind of, be a cheerleader really and bring people into the fold.
And I think I was just going to say that we have a couple clients whose leadership are really front facing, and they've done Friday or sometimes sporadic days where they're calling up everyone on a chat and just simply appear in a costume just for humor. Sometimes people just need to laugh. They need to forget about what's going on for 5 minutes, just put it down. And so he had no problem with putting on the most ridiculous costumes and then talking about the achievements or the accomplishments and recognizing individuals who've gone above and beyond and where the organization was going, no matter where everyone was, because everyone was. We're working remotely, except for those essential personnel. And the employees loved it. They looked forward to it once he started because they didn't know how he's going to show up. And he also inspired his leadership team to do the same. And so a lot of attention was paid to how that message was drilling down to all other employees. But that was just, that worked for them. And I know some of you probably have exceptional examples of how organizations have been managing employees through this. So I have another question. Let's see. Just recently, the CEO of Morgan Stanley commented that he wanted all employees back in the office, stating that remote work is good for some things, but not for professional growth, especially for younger workers, particularly in understanding office and industry norms. What are your thoughts, panelists?
Yeah, that article that I mentioned that I put in by Nicholas Bloom, that was one of the things that he mentioned is the downside of people not coming back. It is that there are certain groups of people that are disenfranchised in terms of their opportunities to grow and develop. So if, people that are at home don't have the same opportunities to be seen, to be, to really, have a presence among the people that are making the decisions about how they grow and develop. So that it's a great point. And it also, can, if we want a diverse environment, if we have certain mothers that need to stay home and that's, because of the school, so they're disadvantaged. So as an organization, we have to look into say, how do we, Brenda, you're probably, the one to really talk on this, but, creating that work environment that, enables inclusion and, equality of opportunity. because this has the potential to sort of, create that again, and would hate to see that happen.
Thank you for bringing that up. Absolutely. For the first time ever, due to the COVID, we've all been in the same bucket. Everyone, regardless, every generation, every age group, to our disabled community, to our LGBT community, and across the entire ethnic spectrum. Everyone for the first time had to figure out, how do we survive? And that's really what it drills down to. And then with all of the social justice issues that have arisen in the last 12 months, people are absolutely overwhelmed. But I can tell you what we are hearing are more honest conversations for the first time ever. Whether somebody wants to hear it or not, there are ways that we're helping employees with that conversation or not. So I can't tell you how I guess you all know how crazy it has been in the last 18 months. It's unbelievable, but something is happening to our culture and to our country and to the world. I mean, the evolution, we are truly going through an evolution. And I don't know if Mother Nature says, okay, I'm done. Here's what you're going to do. I'm taking over. We have to figure out, how do we run and keep up with the times? What new things do we have to create? And if that means that we have to look at be forced, and some of us do have to be forced to say, look, I need to figure out how I can make my workforce more diverse, because I need the talent, the skills, the knowledge, the ability, the education in order to keep this business running. One thing I think employers for sure have told us that they now realize is that they have employees. Well, we've been telling you that for years, but now they're saying, yeah, but I have to do something with them other than give them benefits. Yes, you do. It's finally our turn. We've been preaching to the choir. So for the first time, they're saying, okay, whatever it takes, we have to keep our doors open. We have to keep the business going, because guess what? That's the economy. This is the world in which we live. We want to pay mortgages and send our kids to college, and we want to eat. Food, clothing, shelter, Maslow's hierarchy of needs has been threatened. And so now we're seeing on our side is that more organizations willing to reach out to not just each other and their business communities, but to their employees and even to their employees' families. How do we take care of the entire unit? If your spouse, your husband's out of work, what are some ways we can help you as an employer? If your aunt is sick with COVID, yes, we're going to ask you to follow the COVID guidelines, but we're not going to forget about you. We're going to call and find out how you're doing. We're going to schedule a call with you. And so it's that granular paying attention to every living human being. And I think, Theresa, to your point, that actually is forcing us, because now we have to rely on each other for our very survival. And that is happening. And I don't want to appear naive, because we can't reach and touch everyone, but I can tell you that wellspring of community is actually happening. Next, any reactions? Next question. The question is, after an employee has been onboarded virtually, once moving back into the office, I think we answered this one.
We did that one.
Sorry. Okay. Okay. I like what was mentioned earlier about the legal consultation on some gray areas. That's a question. Hold on, guys.
Brenda, I know Anika also has her hand raised as well, so I think she might have another question.
Do I see a hand? Let's hear the question.
Well, I was just going to ask in reference to the article, kind of going back to talking about professional development. It's sometimes, or at least what I'm seeing is that because of what we used to do and how we used to do things, there's a very big need to going back to doing it the way we used to versus finding new ways to do it. So when we're talking about professional development, I have not read the article, so full disclosure, I need to go read it. However, it sounds as if the professional development responsibility is on the employee to be in the office to get it versus the employer finding new ways to be able to do that, whether it be virtual or in person. I'm a recent grad of Leadership Howard County, and we were the first class, yay, Brenda, we were the first class to be completely virtual. And I know there were a lot of people that, decided not to do it that year or this year because of it being virtual. But I can tell you that we were able to develop all kinds of relationships because now we couldn't break into our little groups, our little cliques at tables and sit with the same people all the time. Because much like this forum, everybody's on screen. Everybody has an opportunity to talk and get to know each other. So I'm wondering if there is a push to go back to what we used to know when it comes to professional development. And yes, the employee does have responsibility in making sure that they get it, but doesn't the employer have some responsibility in finding new ways to provide that for their employees now?
Absolutely. And we're doing hybrids. There's no question about it. Hybrids can work and they have been working. In fact, we need to look at more of that. More organizations are buying subscriptions to LMSs or buying the software to LMSs. LMSs are a great way to keep employees engaged. In fact, we were putting a group of managers through a learning management system to just pump up and beef up their skills during this time. And it's a series of leadership vignettes. Not one is more than an hour. So they're anywhere from 30 minutes to an hour because we know people tune in and out. But they've been very helpful. And then there's the assessment at the end, which we get a chance to see, maybe we should review that one again. That score was just a little low. But yeah, and keep the humor going as well. So thank you. Anybody else want to jump in? Panelists, let's hear from you.
I was just going to say, one of the things we do, which I think is a great opportunity for growth, is that we formed little future leader development groups that were virtual, but we had the attendees identify the topics they wanted to learn, and then each of them got assigned with a partner to teach the class, so that they had to develop them. I guided them, but they were the teachers, and so they had a topic, they had to research it, they had to learn how to develop a training, they had to then learn how to train it, and then they had to learn how to get feedback. And it was so, everybody who's been involved in it has just grown exponentially because they had to learn it. They had to actually do it and learn it and then teach their peers, which, they weren't used to having to do. So that's another idea.
Wonderful.
Yeah, I agree with Anika's comment on the responsibility of both parties. I think it is it is up to us to provide those opportunities, and we've at UHY we've revamped our mentor program. So we've gone back and kind of rewritten the rules or the guidelines for what our mentor program is. We've brought, we've gone through the assignment process. Everybody's got a mentor. We also have done, and this was really, I think, helpful during the pandemic. We had check-in groups with small groups of people, and we rotated them, because somebody mentioned clicks, and I can't stand that personally. I think, it's amazing to me that sometimes, well, not so often, you see that an office is like a middle school, right? I mean, or a high school, and I can't stand it. So I was one of the people who brought this idea up, and I said, well, we're going to do it at random, because it's just, I just want to rotate people around, and you'll get to talk to people that you didn't get to talk to. And then the leaders of our firm, which is the managing directors and our principals and our senior managers, all would lead the group. So it was an opportunity to also find out what those things that people are looking for or need, and kind of brainstorm and figure out how we can provide that for people.
All right, good stuff. Rachel, I'm gonna give you the last word, and then
Right.
I'm going to ask if there are any last minute questions, and then I'm going to turn it back over to Morgan and Leonardo.
Perfect. Thanks, Brenda. So I agree that it should be on both the employer and employee side. We just actually went live with a program that we call Empower. It is through our home office. And that gives the caregivers the ability to self-reflect on themselves and say, hey, okay, maybe I need a little bit more experience on one aspect of how to provide care, or I need information on how to build a relationship. I need information on how to maintain my stress level during work, not just COVID related, but it's then my responsibility to find that right content for them and be able to make sure that they are successful in getting that information and feeling knowledgeable to set them up to be successful. If I guess that answers your question a little bit more, Anika, it's I guess both sides responsible. I'm all about, both sides. If we're expected to do it in the office and we're expected to follow certain policies, procedures, then we expect that in turn of our caregivers. And it's only fair on both sides to have cohesiveness on, just because we're in the office behind a desk doesn't mean that we're any more important than our care staff. In fact, our care staff is what makes our company. So, I think it is more the employees or employers' responsibility, to make sure you set your employees up for success.
Thank you. Fantastic. Oh, what a great group. Thank you. Oh, I've gotten
Steve and
Brenda.
Theresa, you guys were awesome.
Yes.
Appreciate it.
And with that, we are on schedule. Morgan, I'm going to turn it back over to you, and Leonardo. Thank you for everyone.
You.
Thank you for giving me the pleasure of moderating this group. I feel honored. I so appreciate you, and I love sharing all of your ideas. So thank you very much.
Thank you, Brenda. You're awesome.
Yeah, thank you. Thank you.
So
as well.
Morgan, I'm going to let you wrap up, but I did want to say something just really quickly, so I'll lower my hand. But just going back to the other thing, I think just 2 points I wanted to just quickly make. One, I think that, and I left because of the chat, I left a few comments out of the article, because one of the things that's interesting is that Morgan Stanley has already kind of made a few modifications, I guess, after that initial statement was made near the latter part of June. But I think the other piece that it speaks to, and this is another conversation, is just overall the continued importance of diversity in the workplace. If you look at, and again, this is by no means a shot at Morgan Stanley, but if you look at, ultimately it's a Wall Street firm. And I think if you look at traditional Wall Street companies and basically who's in leadership and so forth, whether it's, from an age perspective, it's kind of been traditionally that hard charger in the sense of, maybe it's a boomer where, again, they were often, in their early, staying late, being seen, etc. And so I think one of the things when you read now additional articles that have followed the initial comments, I think it's been where perhaps there've been other professionals within the firm to be able to come back and give other examples of perhaps why some people truly may need that additional flexibility and balance and so forth. But the one point that I will and I'll end on that I thought was interesting, that I said, hey, interesting thought was the gentleman did say, well, hey, look, if people can go out to eat, they can come to the office. And so And so it was just, and I said, well, you know what? He's got a point. And with that, I'll leave that as just food for thought. And certainly Brenda, Steve, Theresa, and Rachel, thank you. Great discussion this morning. And Morgan, I'm going to turn it over to you for a few closing comments and to take us out.
Thank you. All right. I'm going to share my screen for just a moment, really, really quickly. Again, thank you to all of the speakers today, Howard County Executive Ball, Brenda, Theresa, Steve, and Rachel. This was really an excellent panel. Next, I wanted to also thank our annual partners. Again, without them, we would not be able to host these programs. So thank you to them. And then upcoming events. If you are a new member and have not registered for our new member orientation, it is this Thursday at noon at Expectations. So please go ahead and register on howardcounty.com. And then we also have our Gov Connects Biz Breakfast, which is on the 27th. That's going to be from 8 to 9:30 a.m. in person and virtual is an option. So if you can't get there in person, you can certainly join us virtually. Next, we have our coffee tailgate, which is Thursday, the 29th, also at Expectation. And that is from 8:30 to 9:30. We bumped it up because it is going to be outside. So hopefully we'll get that early morning temperature as opposed to the heat that usually comes in at that like 11 o'clock time frame. And then we have our August 3rd elected officials meet and greet, and that is the 3rd from 5 to 7 at the Elk Ridge Furnace Inn. Definitely come and see your local delegates and get to mix and mingle with them. And then our last couple that I'll mention is we have a Power Connections networking breakfast. This is August 4th from 8 to 10 at the Maritime Conference Center. So we basically an opportunity to kind of speed date, which will be fun. And then, oh, thank you, Anika, for putting that in the chat for the new member orientation. And then lastly, just to put a plug in for an advance, we have our cyber conference, which is September 1st, and it's going to be held at the Meriwether Post Pavilion. So those are just kind of some upcoming events. Go to our page and register for those. Really thankful to have you all here today. And please send any other additional questions to myself if you need those answered, and I'll get them to the panelists. And you also can save the chat. If you use the 3 little dots there that are in that chat, you can go ahead and save it if you want to keep all of that good information. So yeah, I appreciate it. And I think that's all we have.
Thank you, Morgan. It was a pleasure.
Thank you, everyone.
Have a great day, everyone.
Yes, thank you.
Thank you.
Bye-bye.